Mr. Archer, let me ask you, you and I have both referenced the Institute for Mental Disease exclusion. When, interestingly, we had Secretary Becerra in front of our committee last Congress, and I asked him a question about that. He actually spoke favorably about perhaps revisiting that. In your opinion, would that be helpful with some of the problems that you're facing?
Yeah, yes, sir, it would. We, at Oceans today, in over half the hospitals we're in and over half the hospitals in Texas, we're the only behavioral health hospital for sometimes 100 miles. And because of a rule that's almost 50 years old in the books, we can't accept Medicaid patients, patients that we're willing to accept, that we have a contract with. And, unfortunately, the behavioral health federal laws are riddled with old rules that point to state hospitals that either haven't existed or have lost beds tremendously over the last 20 years. And so we've got willing providers willing to take patients at accepted rates, and we simply can't because of some of these antiquated rules.
Let me ask you this. What are you doing? We all hear about the workforce issues, and every hospital that I represent will tell me about that. What are you doing to incentivize providers to stay at your facilities?
What I would say is all the above. Whatever it takes these days. It's the number one stressor for us in hospitals, and I'm sure in healthcare and in many industries. The problem is, and the deep-seated problem in behavioral health is, it's now fashionable to say good things about behavioral health, but from a parity perspective, from a payment perspective, a psychiatrist, a therapist knows that they're going to make 20 to 30% less than their peers. So institutionally, we've got a lot of work to do to value the work that they do when they come out of school. One of the most, I think, things that scares me the most is you look at new graduates, you look at new psychiatrists, you look at new therapists. I'm sure many of you may have had a family member or a loved one try to find one that'll take an insurance. Try to find somebody that'll take your insurance in network. And the problem is that the barriers for behavioral health providers have been stacked so high that a lot of folks have just tapped out and said, hey, we're just going to opt out of taking insurance. And so from a workforce perspective, we are doing everything we can to attract and retain the best and brightest. And part of that is inviting folks in earlier in their career to understand what an engaging career in behavioral health is and how rewarding it can be.
You're right. We don't value it, and as a consequence, it becomes a cash-only business. And certainly Medicare and Medicaid, extremely hard to find a provider who will accept that.